don't know about you, but when I was researching on how to prepare my body for my pregnancy journey, I didn't come across a lot. There are pockets of information here and there, but it felt like there was a super laid back approach to pregnancy in the US that didn't really help alleviate some of the common pregnancy aches and pains that are actually preventable for a lot of women. I did a lot of cross cultural research for myself, and in this video, I'm going to share 5 tips I think you should consider on your pregnancy journey. If you're new here, hi, I'm Sarah, a postpartum planner helping women be intentional during pregnancy and blossom into the version of themselves motherhood calls for. I believe how we perceive our realities directly influence how we behave and think about ourselves. So I do a lot of research to ensure that I can arm myself against any false narratives and reframe how I see myself and my motherhood journey. And I'm bringing all of that information to you. So grab a cup of something good for you and let's jump into it. No matter what trimester you're in right now or how far into postpartum you are, go see a pelvic floor therapist. Or if you can't, use solo techniques to help prepare your body for childbirth. If this is your first pregnancy, your parts have not had to work in this way before. So, a pelvic floor therapist helps to strengthen and relax those muscles to prepare for childbirth and can even prevent tearing. And if this isn't your first pregnancy, a pelvic floor therapist can still help retrain those muscles to do it again. They also address common discomforts like back, hip, and pelvic pain. They can do different techniques and show you exercises to prevent urinary leakage, which personally sold me because I did not want that experience. And they help with giving you specific trainings and exercises that can help to strengthen your core and pelvic floor, which means a quicker postpartum recovery and prevents long term issues like having to experience prolapse. I mean, I can talk endlessly about why having a pelvic floor therapist is essential. And honestly, it is a shame that not all insurances cover this support for women. Let me know in the comments if you want me to share what my pelvic floor therapist taught me to do at home to continue to support my body for anyone who wants to see a pelvic floor therapist but doesn't have access to it. No matter how you birth your baby, take time to rest. Research is finally catching up to the acknowledgement that women who suffer from chronic pain and issues later on in life tends to start from an improper recovery period after childbirth. In other countries, women do what's called a 40-day sit, where they do not do anything but take care of themselves and their baby for the first 40 days postpartum, allowing time for their body to recover. I know that the US culture doesn't support that, from the lack of paid family leave to forcing the idea that women are supposed to bounce back physically and mentally almost instantaneously. But I've seen women online talk about doing an amended 15 days where you spend 5 days in the bed, 5 days near the bed, and 5 days in the room. And I'm so for it. Some rest is better than no rest. If you can eat better, do that. And let me just say, if you are in your first trimester, I'm not even talking to you. For your first trimester, just survive. But if you don't have HG and you have a pregnancy that lets you be in the driver's seat, take advantage of that by giving your body the foods that support this journey. And that's for a couple of reasons. One, your stomach is getting all squished up to make room for your growing uterus and your baby. The last thing you need is to try to digest fried food, oily foods, or foods that isn't going to provide your baby or you with any nutritional value. In a world where heartburn, acid reflux, gas is looking for a reason to pop up, it might as well be because you had a nutrient dense whole food like fruits or vegetables, whole grains, omega 3 fatty acids, something that is helping your body. Another reason is because nutrition during this time actually plays a role in determining the risk of chronic diseases later on in life for your baby. And a related tip here, but I think important to emphasize for you, mom, up your fiber. So if you don't know, fiber is a type of carb that the body can't digest. And so it passes through the digestive system and adds bulk to your stool to help you pass bowel movement. Get your steps in. Walking is a low impact exercise that has so many good benefits for you. There are a lot of great health benefits like lowering the risk of health related issues, alleviating constipation, pelvic pain, boosting your mood. And walking also helps with opening up the pelvic and encouraging your baby to get into position so that you're not experiencing like a breech baby, for example. If you're not experiencing a high risk pregnancy, consider interviewing midwives before deciding to go with an OBGYN. Midwifery care is slanted to look at pregnancy as a normal, healthy, physiological process for the majority of women. Obstetricians, on the other hand, are actually surgical specialists for high risk patients and often view pregnancy as a medical event or a condition that is difficult to manage and needs intervention. They've been trained to be medical specialists that look for and rule out problems. And so that's how they look at pregnancy. So if you don't have special needs that require this approach, it may be worthwhile to check out a practice that has midwives. I hope these tips are helpful to you. Let me know if you want to know more about who I had on my pregnancy team in the comments below, and I'll see you in another video.